Hey, this video is going to go over ACE inhibitor side effects, why they occur, covering the basics, what you need to know for board exams. These are super popular questions on all sorts of medical, nursing, paramedic board exams. And it's important for people to know because a lot of people are on ACE inhibitors. Now, what's an ACE inhibitor? Some examples of them are like enalapril, benzapril, lisinopril is one of the most common. As you notice, all those, they all end in pril, P-R-I-L. So if you have one of those, if you have a drug that ends in pril, it's probably going to be an ACE inhibitor. Now, what are ACE inhibitors used for? Well, they're used to treat high blood pressure or hypertension. They also can be used to treat heart failure, like CHF, congestive heart failure. And what do they do? Well, ACE inhibitors work to treat hypertension by inhibiting the ACE enzyme, right? So that's the angiotensin converting enzyme, ACE. And they inhibit that. And what that does is that turns normally ACE, so when it's not inhibited, so there's no I, right? Just ACE turns angiotensin 1 into angiotensin 2. And then we have a video talking about all the different things that angiotensin 2 does. But really, that's the thing we want to stop. We want to stop its production. Because angiotensin 2 works through like 5 different mechanisms to raise your blood pressure. Increases sympathetic tone, increases fluid retention by stopping, like salt, diuresis. It just, angiotensin 2 is a major player in hypertension or high blood pressure. So what ACE inhibitors do is they come over here and they stop this. They inhibit this production of angiotensin 2. And again, we have another video if you want to talk about that. Interesting aside, ACE actually is made in the lungs before it does all this stuff. Right. Okay, anyways, as we're talking here, we inhibit angiotensin 1, turning to angiotensin 2, but these ACE inhibitors, although they're very great drugs for treating high blood pressure, have some side effects. And what are those side effects? Well, the ones you need to know for board exams are cough, especially like a dry, barking cough. And the second one is angioedema. And edema is a fancy word for swelling. So you'll hear people that take this drug, the most common side effects for taking this drug are cough and edema, or like swelling in my legs, my ankles. Man, I got a lot of fluid down in my ankles. So that's what you hear people say they have ACE inhibitors. If they do have that, we switch them over to an ARB, angiotensin receptor blocker drug. But we're going to talk about why these side effects occur with ACE inhibitors in the first place. And it's funny, they both actually are caused by the same mechanism, and that mechanism is increased bradykinin. Now, bradykinin is going to be what you're asked on board exams. They're going to say, by which mechanism does an ACE inhibitor cause its side effects, cough and edema? And that's going to be because of an increase in bradykinin. Now, why does that happen? I mean, where did bradykinin come from? What is it, and who cares? Well, bradykinin is an inflammation mediator. It's a molecule that causes an inflammatory response. So like inflammation, so like fluid and coughing and pain and all those different things, inflammation, right? So normally this ACE enzyme, not only does it do this, it converts angiotensin 1 to angiotensin 2, which causes hypertension. I'll write that over here just so we're all clear. But another thing that it does is it also deactivates bradykinin, just because that's the way we're made. So it inactivates it. So if you have a normal function, man, that's messed up. If you have a normally functioning ACE, angiotensin converting enzyme in your body, made in the lungs, you're going to decrease bradykinin. You're going to decrease the resulting inflammation from bradykinin. But like we just said, if we use this ACE inhibitor, not only is it going to prevent hypertension, it's also going to prevent this inactivation of bradykinin. So if you prevent the prevention, that's essentially like saying you're going to raise the bradykinin. And if bradykinin is raised, that leads to your cough, inflammation, edema, and those most common side effects you get asked about. Now, if we switch to an ARB, angiotensin receptor blocker, it actually works in a similar way in that an angiotensin receptor blocker it comes up to angiotensin 2 and it blocks its receptor. Angiotensin receptor blocker. So it blocks its receptor. So just like an ACE inhibitor, we're essentially blocking angiotensin 2 and thus stopping hypertension with an ARB. They're not as commonly prescribed. ACE inhibitors are usually like a first line. Yeah, so that's one thing you could change to. And since angiotensin receptor blockers, they don't do anything to the ACE enzyme, then you're still going to get this inactivation of bradykinin. So bradykinin would then go down and you wouldn't have the cough and edema. And that is why, or angioedema, excuse me, and that's why ARBs don't have that side effect even though they still work on angiotensin 2. So yeah, ACE inhibitors are used to treat hypertension, but their side effects are cough and edema because they inhibit angiotensin converting enzyme, or ACE, which normally inhibits bradykinin. All right, bradykinin is the big molecule there.